Hi, everybody. This is Sue Ann Jackson from the State Unit on Aging. Welcome to our continuing series for 2017 of monthly webinars that the State Unit on Aging does for the ADRC partners. We're pretty excited about this one today. I have here with me Sandy Abrams.
Good afternoon, everyone.
And Thomas Schwartz from the Office of Abuse.
No, Office of Adult Abuse Prevention and Investigations.
I'm so used to saying OAAPI, but I wanted to not use lingo. So we're really excited to have Thomas with us, and I'm going to let him talk. But first, let's just do a couple of housekeeping things that we always do. We are recording the webinar today, so we do have you guys all muted. Please do your text chat questions, and I will keep an eye on those while Thomas is talking and bring them to his attention. Also, if you're a group site, please type in, let us know who all's at your group site so we can keep track of that. We sent materials out yesterday, but if you hadn't registered by then, I also put the PowerPoint in the handout section, so theoretically you should be able to download that out of the handout section. And we will have some poll questions during the webinar. We tried those last time, and they worked pretty well, so we're going to try some again today to help give you guys a little bit of interaction with us. If you can't download the PowerPoint, you can also send an email to Lori, Lori.c.watt, W-A-T-T, @state.or.us. And just in the subject line of the email, tell her that you need the webinar materials, and she'll shoot that right off to you. That way you can follow along with us. Also, we want to remind you that at the end of the webinar, we usually shoot a quick email out in the next hour or so and ask you to spend about 5 minutes on a little survey monkey letting us know how we did. And I'll remind you again at the end about that. So at this point, I want to just introduce Thomas. We're very excited to have him here today, and we are going to let him talk now.
Okay. My name, let's go ahead and move this forward.
Oh, yes. Okay, now.
Okay. My name is Thomas Schwartz, and I've got over 25 years of specialized experience with protecting vulnerable populations. I was a police officer and also an abuse investigator for the state of Oregon and some county agencies. Currently, I serve as a training and development specialist for the Office of Adult Abuse Prevention and Investigations, OAAPI, as many of you know, or OAAPI. And I'll share a little bit today about the role of Adult Protective Services. I just wanted everyone to know that we're going to be going through the slides fairly quickly, but there will be opportunities to answer questions. If you would please take notes on anything that you are wondering about. When you find a break in, we will go ahead and answer those for you. Okay. So what you see up on the screen right now, it basically describes to you what OAAPI, where we provide support. We reach out with supports to a variety of different programs in abuse investigations, and that includes Adult Protective Services for aging and people with physical disabilities, the Office of Developmental Disability Services, Oregon Health Authority with mental health programs, and there's others as well, different support agencies that protect vulnerable adults and children. In 2015, our OAAPI analysts, trainers, and investigators, and administrative staff supported the field on nearly 43,000 reports of possible abuse. Our office also conducts investigations for child caring agencies and the stabilization and crisis units. We also provide specialized investigations when there are conflict of interests at the local level in the mental health and developmental disability services arena. As you can see up on the screen, I don't know if, can you read it off of, is it large enough print for you to read? Okay. So we have 58 developmental disabilities county investigators, 160 adult or APD investigators, and that includes our AAAs, and 58 county mental health investigators. The breakdown you see up there: quality management and prevention, policy and legal affairs, investigations, and field operations. Our organizational chart has changed recently. We used to have 4 different divisions, now we have 3, but it seems to be much more streamlined. And if you contact our office, we'll get you to the right people depending upon what it is you're seeking. So, abuse prevention. Oregon citizens rely on us to prevent abuse. They rely on all of us as citizens, as people with different jobs. And in this presentation today, we're going to be focusing on older adults, and because, well, that's what we're assigned to do, but also older adults are one of the largest populations of vulnerable citizens in the state. There's 4 other groups that we serve, and they're also considered potentially vulnerable. They are children, adults with mental health issues, adults with physical disabilities, and adults with intellectual and developmental disabilities. So today's webinar is relevant to every one of these groups because they're all protected, but you are the frontline protection and prevention from abuse. So there's a community responsibility. Everyone should be responsible for the safety of the people in their community, and anyone can and should report if they believe a vulnerable person was abused. Some people are required to report, and this leads to a very serious question. Are you required to report abuse? If you are, then you're called a mandatory reporter. And from what I understand in discussion today, everybody knows that you're a mandatory reporter. Is that correct?
I'm not sure they all do, but we hope so.
Okay.
So just a reminder that as a contractor of the State Unit on Aging, the Department of Human Services, that is how it's defined in rule, that you're then a mandatory reporter and you have to comply with all of those said pieces. That's one of the many reasons that we wanted to have Thomas here with us today to talk more about this, so that you become more familiar with your role as a mandatory reporter.
Okay, awesome. Thank you. So we're going to go through mandatory reporters right now, and there's our question: are you a mandatory reporter? Or are you required to report? So who are mandatory reporters? There's a bunch of people listed on here, so I will just go ahead and show you. For people like you who are professionals that interact with others as part of their job, there are some things that are important to know. First and foremost, you must know if you're a mandatory reporter. People in these jobs and roles are mandatory reporters. And I'm going to let you read those because there's lots and lots of them. But please, if you have questions, let me know. Should be it.
I'm seeing quite a few of you folks on those lists up there.
So from what I understand, what was said, AAA agencies are up there. We've got senior center employees that you might come across, DHS, OHA personnel. There's just a number of folks up there, and I'm sure that you may recognize some people that you may not have known are mandatory reporters also. And the list keeps on growing and growing.
Okay, so we have a true and false question here. I'm going to see if I can launch it for you guys. So I opened up the poll. If your job says that you are a mandatory reporter, It means it's against the law and or administrative rules if you fail to report. Is that true or false? Oh. We'll give you guys just another few seconds to vote. It looks like people are going. And again, we want to remind you, if you are a group site, please text chat us who else is at the group site. Looks like we've got a good portion of you guys who voted. A couple more still coming in. Everybody's saying it's true. What do you think, Thomas?
I think they're right, and I'm really glad to see that. Even if they weren't all required, I would still want them to report, because we really want to advocate for those who can't advocate for themselves. So we'll go ahead and move forward here a little bit. Oops, I think we're stuck.
There you go.
Okay. So mandatory reporters, they have to report suspected abuse immediately, and that is for children. That's 24 hours a day, 7 days a week. That's for adults over 65, and that's 24/7 as well. But it is a crime, and it is a violation of administrative rules if you fail to report. In most instances, let me back up a little bit here, because I think I'm jumping ahead. Okay, for those who work with people who are experiencing intellectual developmental disabilities or people experiencing mental illness, you are required to report only while on duty. Now that, I just heard as of today, is changing on the 1st of January, 2018. So all of our protected groups will be under the 24/7 rule. And that's really good news for mandatory reporting and ensuring people are safe. For me, it could be a little complicated. I'm going to have to change a whole lot of training materials, but I'm very happy about it because I'm a strong advocate for reporting. But our office actually assisted the legislators in writing up those changes, and so just know that as of the 1st, they're all covered, 1st of January.
So we have a question here before Thomas goes any further. Let me let you have that one. Sorry. Oops.
I was about to give that away, wasn't I?
Okay, we told you we were new at this, so. Now I have to get you back to the webinar. Okay, here's the poll, guys. Which, if any of these, are potential consequences for a mandatory reporter if you fail to report abuse? So you've got A, B, C, D, or E. Okay, it looks like everybody's pretty much voted. So we're going to close the poll and share. And it looks like 87% said all of the above. So what do you think, Thomas?
I think that 80% of them, or 87% of them are correct. If you fail to report, it could result in loss of your professional license, loss of ability to work within the Medicaid services, or you could face legal penalties. They're usually in the form of a fine. These consequences are usually only seen in the most egregious situations. More commonly, if something occurs, it's people who fail to report abuse will receive some kind of disciplinary action by their employer, or even could lose their job because of contract requirements that are written in their job descriptions. The takeaway from this slide is make the report so you don't have to worry about your job or any kind of consequences, but ultimately make sure that we're taking care of people. Oh, need to that again.
There you go.
I did want to back up on there just a little bit. We don't want everyone to worry about losing your job or having this happen. We do have an understanding that people don't always make the report simply because they didn't understand the dynamics of what occurred. It does happen sometimes where we end up educating someone through an investigation. So when I mentioned previously about it being the most egregious, that's where we're giving that wiggle room. If it's really obvious and you didn't make the report, we probably wouldn't be able to have any wiggle room. So, but we do want everyone to know how to do it right. So to report suspected abuse, well, first off, it can be confusing to figure out if something should be reported. And what we really advocate for is that if you're just not sure, a good tip is to pay attention to that gut feeling. Your hair may be standing up, or you're just sensing something isn't right. I can give an example of this when I was a police officer. If I would walk up on a vehicle that I'd made a traffic stop on, and I felt the hair stand up on my neck, I knew something was going on in that car that I hadn't quite processed in my mind yet. So when that happened, I knew back up quickly. And the way society works these days, with all the comforts of being safe, we don't have to worry about being attacked by lions in the forest. So we don't often pay attention to those little gut feelings and those hairs standing up on the back of the neck. But in these instances, if you notice it, that's the moment where you need to go, and slow down, back up, and think about it for a moment, and then really pay attention. Okay. So if you experience this, make the call. It will remove all doubt, and you may find out that that little feeling was actually abuse, or you may expose problems that can lead to abuse, or you could even find out there were other things that could have been harmful to someone that were in their environment or how people are treating them. You might be able to do some preventative work. Remember, you can't get in trouble for calling, and you actually may be the key to helping that person get what they need. So on a similar note.
Do you want to read the scenario first?
Yeah, I'm going to go ahead and read a scenario to you, and there'll be some questions to follow. And this is on a similar note as far as the reporting. So Stanley was a 74-year-old gentleman living in rural Oregon. Staff from a local shelter called about him, and he had arrived to their facility the day before in a taxi from the emergency department after reportedly being examined for slurred speech and problems with incontinence. They told the taxi driver to take Stanley back to the emergency department and explain to them that they do not have the staff that are qualified to meet Stanley's care needs. So now, when they call, they said they just received a call from the police, and they were looking for the shelter to help them because there was a man wearing soiled hospital gown, and he was found sitting in a restaurant drinking coffee after being dropped off by a taxi earlier in the night. He'd been there all night long.
Okay, so the first question is, yes or no, do we have some kind of abuse happening here? What do you think? So we'll give you 30 seconds to vote. So far, it looks like everybody's saying yes. People think there is some kind of abuse happening.
Is that everyone?
That's pretty close. Okay, looks like everybody said yes. So the second question is,
I'll answer that, by the way.
oh yeah, go ahead.
So in this instance, this was actually not abuse. This was a breakdown in communication. And that's what it was. We'll go further now with the next question.
So the next question is, what do you do in this situation? So there's several options here. What are you going to do? Are you going to call the hospital, call the governor's office, call the news agency, call APS, or all of the above? So go ahead and vote. What are you going to do in this scenario? Thomas says there is not actual abuse happening, but this person is definitely got some issues going on. We've got a few people still voting. We'll give you a couple more seconds here. Looks like everybody's voted now. Okay, so it looks like most people said they're going to call APS, and a few people said they would call the hospital to file a complaint.
Okay. And those are both valid answers. The most correct answer is actually to call your local Adult Protective Services agency. And calling the hospital to file a complaint really should be secondary in this matter, because APS is going to be able to get services out the most quickly to help someone like Stanley. I'm going to tell you a little bit more about him. It was actually very unfortunate for this person, and the names were changed, just so you know, but it was based on real events. And Adult Protective Services actually got the real call on a Friday morning, and they were able to enroll the person in services through APD in an adult foster home. But over the weekend, the provider from the foster home took the person back to the emergency department after they noticed their health was declining quickly, and the person died only a few hours later. So Adult Protective Services later learned the person had gone to the hospital several times in the weeks before and was complaining about something being wrong, and they couldn't find anything, and the person was actually walking and talking normally in those other situations. Mm-hmm. I don't know what the situation was behind that when he was having he or she, because actually this was changed. It could have been a she. The person, they may not have recognized the changes. It may have been a different shift, who knows. But the bottom line is there were some problems that were occurring, and maybe they could have changed, maybe they could have provided a service that would have helped. So ultimately what ended up happening was, I'm sure the hospital was called. I'm sure, who knows, maybe even the governor's office was called. I didn't get enough of that information to actually know. But we don't know if this person was ever even aware that Adult Protective Services could connect them to services that would help them. And after the event, they worked with the hospital, social worker, with police, and shelter staff, so they would know how to work together and call APS for assistance when things like this happen in the future.
Great.
The positive changes that happened were that the community learned how to report when things like this happen to prevent tragedies in the future. And so the main takeaway here is to call the right resource for the situation. But even so, the other ones you can call, but we want to make sure if we can call APS, we can get it done quickly.
And we did not have ADRC on that list. Thank you, Christy Murphy, because we could have had ADRC on that list, and if you would call ADRC, they would get you to APS. You call ADRC and say what's happening, they would have gotten you to APS. So thanks for mentioning that, Christy. We appreciate that. And then we just had one question from somebody that said, you know, what if you're concerned about the safety of this person? You know, you're going to report, but what do you do in the meantime about the safety of this person who's getting jumped around or whatever?
Okay, so the numbers that were provided on the previous page are all places that you can call, and they should all know at these different places where to connect you. I'll explain a little bit more about, so the SAFE line, that's a central clearinghouse type number. So when you call it, you would actually be prompted through different prompts. and it would ask you, are you calling about someone in the children's, the different protective service segments we spoke of, those pieces. So children or mental health or developmental disabilities or adults over 65. So you'll get prompted through those things, and then it will ask you for your zip code. So you put your zip code in, and it will get you to the closest office respective to whatever you put in on the other prompts. It's helpful, and you can leave a recording after that. If there's someone on the other line between the regular working hours, 8 a.m. to 5 p.m. during the week, it will get answered immediately, but there's the sticking point about that. If you leave a message and there's something immediate like what happened with Stanley, we want to make sure something's really going through. So local APS offices, it's really good to know how to contact them directly, and those you can find on the website. ADRC can help get you directed in that way as well, but when we're speaking of immediacy again, they may not be able to get you there as quickly as possible. Law enforcement, in this instance, law enforcement had to be educated, but that is part of the process of change that has been happening in Oregon for a number of years now, is to educate law enforcement on how we interact together. And then 911, of course, works with law enforcement as well. Does that answer it?
Well, this person is also asking if it's a financial elder abuse or a physical protection from an abuser immediately, and it sounds to me like you're saying you would call 911 in that situation, as well as reporting to APS. No? Yes?
Okay.
It's an immediate.
So you've just spoke about two different things. So financial is probably not going to be as immediate.
Right.
Yes, it seems immediate when you're watching a bank account disappearing, but that would still be something you'd want to call to APS. But when we're thinking of someone who's in harm's way, we want you to call 911 if it's an emergency. Okay?
Thank you.
Okay.
So I'm just going to jump in for a quick moment and say, we're all human services professionals, and if what your agency is directing you to do is to go out and sit with Stanley in the cafe while the police are coming or whomever, that is fine. We're people, we have skin on, and some of our individuals we work with, we want to be that compassionate, but we do want to do a warm handover to our partners that we're working with, and we've gotten some clarity here today.
And you also want to stay safe yourself.
Exactly.
Right. Yes, we want to make sure everyone's safe out there, and ultimately, if it became an unsafe situation, let's say perhaps Stanley became violent, we would want to make sure that you were calling 911 for your own protection. Okay.
Okay, I think that's all the questions for now, and we're ready to move on.
Okay.
And for this one, we have a question to see if anybody knows what are some of the factors of the aging process, the normal aging process, that can affect our vulnerability to abuse. So I'm going to launch this. So we've got a few answers here. So take a look. What are some of the normal aging factors that can affect our vulnerability for abuse? We've got some different things: decreased visual acuity, cognitive skills beginning to slow, short-term memory, difficulty understanding, speed of processing information. So go ahead and answer. We'll give you guys about 30 seconds. You guys are just too good. You're too good. So it looks like over half of you have voted now. So we'll go ahead and close that up. Oh, we got a couple more voting. You guys are awesome. Oh, it's all of them.
All right, now they know. Okay.
So awesome. So about 90% of you voted, and here's what you show. And the correct answer is all of them, as Thomas is going to tell us
yes,
about.
all of the above. and I need you to activate that. That's okay. 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 Well, one thing I really want to point out to you is that some older adults will never be vulnerable to abuse for a variety of reasons. Some of us, we keep our mental faculties for much longer, and others, it depends. I mean, there's all different factors that come into play there. The scenario we just worked on, that really requires us to think about some questions about vulnerability and risk, though. And anyway, yes, we do look at all of these different things as possible things that would make you vulnerable and be at higher risk. So I'll go ahead and read what we have. We have decreased visual acuity, cognitive skills, including abstraction, calculation, word frequency, verbal comprehension, and inductive reasoning. All those things will show slight or gradual decline as we get older. Short-term memory declines. There's difficulty understanding abstract content. Speed of processing information becomes slower. Reduced physical abilities and increased medical needs. I can attest to this. I had surgery 2 months ago, and I'm in relatively good shape. And I have to say that it was a real good dose of reality for me on how life can be in the future when I'm not mobile and when I'm on medications that are heavy and can't think straight. It's been 2 months and it's still a struggle for me with a lot of these different things. My energy level's lower. So all of these things can have a great effect on our risk.
Yeah, thanks.
Yes.
We do have another question. How many layers of reporting are necessary to cover ourselves professionally? The example they want us to think about is a home care worker informs the case manager, and the case manager encourages the home care worker to call it in as a first-hand witness. Should the case manager also call it in because the home care worker came to them about it? Or is it just a direct witness only? Multiple party reporters informing the case manager. Should the case manager, report on top of those people reporting?
I always say, cover yourself, okay? The bottom line is, if you're trusting someone else to do it who's a very busy person and it slips their mind, and you were the person who was the frontline person and didn't make the report, there's a distinct possibility that you're going to be the one who is looked at as, hey, you never reported this. You can say, well, I told Joe or Susie to do that. Well, you're still the one saying, but I told them to do that. And ultimately, you're the first person to come across the information. So ultimately, you're going to want to be the one to do that, and we can sort out later on if multiple calls have come in. Great,
thank you. I think that was a good question, and I think that was a great answer.
Okay.
It's, the more the better, right?
Right. And I'm glad that you asked that question,
Yeah,
too.
Thank you.
Where are we? Okay, I missed one of our buttons there. So vulnerability and risk. There are other things that make anyone more vulnerable to abuse, but it does tend to happen more when people get older and their friends start dying and things of that nature. So, and family members as well. So we're looking at social isolation, depending on others for tasks or personal care, living with others in a group setting or with family or other settings. They've got no family nearby. There's few long-term relationships, limited close friendships, and little to no community support.
And these are definitely flags for you guys out in the field, or even if you're an information and referral specialist on the phone. If you're hearing some of these kinds of things, then you want to, put your radar screen up.
Mm-hmm. And one of the things, so we're teaching a class downstairs right now to investigators, or actually adult protective services specialists. And if you listen to them in their discussions, the difference between what happens in Pendleton or in Klamath Falls as opposed to Portland and Multnomah County or the busier metropolitan areas, it's much, much different. There's a lot more coverage that happens in Portland. They actually have abuse lines that are covered 24/7 in Multnomah County. So there's actually a human being answering the phone most of the time, unless they're too busy to get them. But when we look at Pendleton or wherever, Burns, yeah, that's what I was thinking of. It's actually the next one I was thinking. Yeah, there's going to be limited access. So the social isolation also can come into play even more so in those situations, but it does happen in cities as well. When we look at say somebody who's declining in their health, maybe their cognitive abilities have changed to the point where they're not coming outside as much, or maybe they're having these problems with incontinence or something of that nature, and they're feeling embarrassed to go outside because they're afraid to show themselves in public because they might have a problem with incontinence. So these are the kind of things that we need to pay attention to. So if a couple or a person normally would come out into the community and spend time, and suddenly they stop doing that, pay a little closer attention to them. Okay. So vulnerability and risk, we're looking at housekeeping needs, home repair needs, upgrades, and technology. So there's some other things that can happen as vulnerability and risk increase. And so people may need more supports in their daily activities, and their environment might be changing. They might need help with cooking or housekeeping. They can't keep up with their home repair needs, or their old neighborhood might literally becoming the old neighborhood. Unsafe conditions might be happening because the homes are just falling apart. There's other unsafe conditions in or around the home that they can no longer deal with because they can't get up and move around like they used to, or maybe the person who is helping them passed away. And then, of course, technology changes. I don't know about the rest of you. I work with technology all the time, but if I go from one piece of technology to another, I'm stumped. And it takes a while to learn those new things. Okay. So what is abuse? We're going to go over some of the definitions here, specifically for older adults. We'll be brief. They're very brief. They're abbreviated, as a matter of fact. So, and we're also going to be speaking a little bit about self-neglect. Older adults have self-neglect as something that is looked at as to where other identified vulnerable populations do not have self-neglect. Abuse is essentially causing harm or taking advantage of a person. And our laws are similar for all groups of people, but those who are 65 or older, they have their 8 categories. And when we look at self-neglect, those get investigated. Technically, they're investigated as abuse, even though we don't really have a perpetrator of that abuse, but they are investigated in that way. So Adult Protective Services is still called in that instance. And we want to remember that older adults can also be affected by mental illness or intellectual and developmental disabilities. So there can be crossover as far as these things go. So we're going to look at these abuse types now. So physical abuse seems pretty simple. We're using physical force that may cause pain or harm, or there's a physical injury that is not an accident. Well, if a number of you, from what I understand, are working over the phone lines, and you're not necessarily going to see these signs of abuse, but what we really want to emphasize is to please pay attention if someone is speaking about these things. If you hear them talking about getting a bruise and something doesn't feel right, cuts or abrasions, the story of how the person was injured just doesn't make sense. Frequent sprains, repetitive hospital visits, or broken glasses, that could be an indication someone was struck. And remember also, if the person tells you that they've been hit or pushed or mishandled, and this is a sign of abuse, make sure you make the call. types of abuse or neglect: not providing basic care or health and safety needs for a vulnerable person when there is a responsibility to do so. Basically, when these actions are putting someone at risk of harm, then we may have a case to investigate. We don't expect you to determine whether they're at risk of harm or not. We just want you to react if you have that feeling or that notion. So some of the things that come up, and they may be common things, but I'll tell you some signs of neglect that we look at when we're doing investigations are urinary tract infections, fragile skin, bed sores, malnutrition, dirty clothes. Their home is dirty, despite having a caregiver assigned to do this kind of work. They're not getting medication as prescribed, or they're wearing inappropriate clothes for the weather. Some examples: home care worker may leave without doing an example of neglect. A home care worker may leave without doing range of motion activities with an individual that can result in painful muscle contractions, thus resulting in harm. They've had pain inflicted on them. A little bit unusual that way, but try and think about those things as you're listening. Sometimes, though, when it comes to responsibility or assumption of a responsibility, it's not necessarily formal. Obviously, with the home care worker, it's formal. They've been hired to do a job. But say the person is receiving some kind of supports from people outside that are considered natural supports. What this means really is that someone's coming over and helping them regularly, and it's gotten to a point where they have an expectation of support from that person, and then suddenly they just stop, then we can actually look into that as an abuse, a potential abuse. And again, if someone is telling you that they're not getting what they need, Adult Protective Services or the ADRC, they can help you figure those things out as well. So types of abuse for abandonment. So we're talking about deserting a person whom you agreed to provide care to. So this has to result in harm or a risk of serious harm. So when we think about abandonment, it's actually an egregious form of neglect, and where the deserting or forsaking someone placed them in jeopardy. And most often, things that feel like abandonment will actually end up being neglect. But just remember, it's not up to you to know if it's neglect or abuse, or abandonment that the person's experiencing. The APS specialist is going to figure that stuff out for you. And again, if it doesn't feel right, call it in. So verbal or emotional abuse, talking about written, spoken, or gesture directed to the vulnerable person, causing significant anguish or distress. So what are some warning signs of this? Change in behavior when a caregiver or a person in their life enters the room. Change in friendliness. In other words, you see a change in how a person who normally was chatty in the past all of a sudden isn't. That can be a sign. They might seem afraid to talk in general or about specific topics. There might be a change in appetite or weight. There may be stories that don't make sense. There might be an onset of depression or anxiety, or they might be upset or anger easily. Another warning sign, again, is if they tell you. But keep in mind that verbal abuse often goes hand in hand with other types of abuse, and people may be threatening to keep them from disclosing abuse that's happening to them. So verbal sometimes will be a threat. If you say this, I'm going to do this. But physical abuse or domestic violence might be happening as well, and that could also be a factor in why somebody's not speaking to you in that way. So just don't shrug off the potential for verbal abuse because you think it's not a big deal. It actually can be really harmful. So financial exploitation. talking about taking money, things, or property without permission, taking a person's medication, spending money on things that are not for the person's benefit. So warning signs that we're going to want to look out for are the person suddenly unable to pay bills. And one of our gatekeepers oftentimes may be the Postal Service. They suddenly see all these bills that they're seeing these late notices being dropped in the mailbox. Or there's a disparity, on to the next one, disparity between income and the way they're living. So in the past, you've seen that they've had adequate income, and they may still have that, but suddenly they're not able to afford food. Where's that money going? The person is not open to the idea of assistance with managing finances, checkbooks or bills. Their lifestyle or status of the caregivers or the family members don't match up with their economic situation. So you've got somebody who was once a poor caregiver and now they're driving a brand new, we'll just say Mercedes to throw it out. I have my doubts that it would happen that quick, but you will see in financial situations that can happen, a progressive lifestyle change even happening where it doesn't really make sense with who they were when you saw them before. The vulnerable person may not be allowed to go anywhere independently, like the store or the bank. So someone might take them to the bank and they're cutting them off from saying things as they're trying to speak to the bank teller. Like, oh, they're so forgetful, I'll take care of this for them. And this person may be getting slowly beaten down to think that they are forgetful. They may not be forgetful, they may have made a mistake and the person decided to use that against them as a means of getting to what it is that they wanted. Okay, so indications of increased risk. Again, we spoke previously about visual acuity. There could be a decrease in that. Their cognitive skills may be limited. They might have trouble with calculation or word frequency, verbal comprehension or inductive reasoning, and you may be seeing slight declines in that. Also, short-term memory can decline. They might have difficulty understanding abstract things, and speed of processing information becomes a bit slower. Sexual abuse. Pretty much, I'll let you read that up there, but I'm just going to say it outright. Pretty much anything you think is sexually wrong or know is a crime is going to be sexual abuse. The administrative rules duplicate all of the criminal statutes are included regarding sexual abuse within the Oregon administrative rules. There are some differences when we do our investigations, and this isn't for the frontline people to take care of, but it's for us to know if it's done without consent. So and consent means that a person voluntarily agrees or there's a concurrence of wills between the people that are in the act. Mere failure to not object, though, does not in and of itself constitute an expression of consent. So involuntary seclusion. Someone is restricting a number of different things. It could be contact or activities with family or friends, restricting phone or email, mail. They may be restricting movement by limiting a person to one area of the home or wherever that they're allowed, wherever they can freely access normally. So what we are going to want to do is watch for changes in typical activities. This is similar to one of the other ones we said, such as not going to events they're typically attending. You're going to want to listen for disclosure, like the protected person tells you they're being told that they cannot leave the house, or family and friends are being told that they shouldn't come over for visits. And this may be by a caregiver or the protected person. Maybe they've been saying this because they're afraid the caregiver, or have been instructed by the caregiver, tell them don't come over. Types of abuse. We're looking at right now physical and chemical restraint. Things you want to pay attention to there are bruises on the wrists or arms or ankles. If someone's got unusual sleepiness or unusual slurring of words. It's not uncommon for people, I don't know if all of you know this about Benadryl, but I'll go ahead and tell you this. A warning sign might be if a person tells you, Betty says I get cranky when I'm tired. She gives me Benadryl, so I'm not cranky and she can get her work done. Okay, so what is Betty doing? She is giving this person Benadryl to make them go to sleep so she can do whatever she wants. Maybe it's not her work, whatever, but she's doing it for her own convenience. And as a caregiver, that's not something we're allowed to do. Self-neglect. Okay. Oops. Self-neglect does not involve harm, or does not involve wrongdoing. What it does involve, though, is harm or risk of harm. And this is a situation where an individual places themselves at serious risk because they lack the ability to understand the consequences of their decisions. So we're thinking about two different parts here. First is the person is at risk of harm because their basic needs are not being met. And then the second piece is the person does not understand the consequences. So we don't expect you to find that stuff out. But if you come across something that where you believe there's a problem, you can go ahead and make the report and we'll do the figuring on that. But just remember also, everybody has the ability to make a bad choice in their life. But we encourage you to make the call if you think there's a problem. So Adult Protective Services specialists, they understand that there's a balance between self-determination and risk of harm. And even though people have a right to choose an alternate approach to their priorities or their lifestyle, we have to remember if it doesn't look right or feel right, make the call. They're trained to deal with those situations. And they'll do their best to work out whatever it is to help find the best option. So we have another scenario.
Before we go to the scenario, Thomas, can
Yes.
I just ask you, I know one of the things I hear as a trainer of frontline field folks is that, we're all so busy. We all have such huge amount of cases and, they're worried about, everybody's overworked. And so we're worried about, calling. And you keep saying, call. So could you just talk a little bit? I'm sure APS have the same caseloads that other people and are just as busy, but we should still be calling in, right? That's still
The APS folks, of course, they cringe when we say it, but we have to say it, and we really want to say it, because when that person slips through the cracks, then ultimately, we honestly don't want to be putting them in that situation, and we also don't want to be the person who carries that burden on their heart later on when they realize, oh wow, I knew about this and I didn't do something about it. It can really be traumatizing to even make the report alone, but if you saw the abuse and didn't make the report, it could really be bad.
So make the call. Don't worry about it, right?
Please do.
Thank you.
Okay. Do we have time for this?
Oh, absolutely.
Okay.
So we have another scenario that Thomas is going to read, and then we have some questions around it.
Okay. So a woman named Rose calls asking what she can do about her brothers, David and Charles. David hasn't had a job for several years, and he's been living with their 79-year-old father, Richard. David claims to be taking care of Richard, but he's been spending all of his money on extravagant things for himself, like remodeling the entire basement that he now uses as his personal apartment. Also, David has moved his daughter, Julie, into the house, and she's living in the apartment with him, and she's also got a child of her own. Now, Rose finds out that Charles moved in upstairs. That's the other brother. And he moved in with Richard because he lost his job and he doesn't have a place to live while he's going back to vocational school. Here's where things get interesting. And they're already pretty interesting. Rose, she said that Charles and David don't get along. So hold on just a moment, I need to. And Rose says that they've been arguing and using profanity in front of Richard. And this is especially after Charles found out that Richard bought a car for David on top of the apartment being remodeled. And he's changed his will, giving David the house after he dies. So Richard is very conservative, and Rose is really concerned because her dad is distressed when her brothers are fighting. And now Charles is telling Richard, his father, that he has to buy a house for him as well. Rose tried to intervene at this point, and she said, Charles says, he should buy a house for me too, it's only fair. So Rose has been trying to contact Richard's older brother, Ralph, and anyways, he is the patriarch of the family, and apparently he makes more sense than anyone else in the family.
So that was a convoluted scenario, but the bottom line is, we want to know, yes or no, is there potential abuse going on here? So we'll give you guys a 30, 40 seconds here. Do you think there's potential abuse going on here? Based on all the things that Thomas has been talking with us about? Looks like everybody's feeling like there might be. Looks like yes is the answer here.
Okay. And yes is the correct answer.
Okay, so we have another question for you. So now that everybody feels like there is potential abuse, what kind of abuse do you think it is? So we have three choices. Is it financial abuse, is it verbal abuse, or is it something else? So we'll give you about 30 seconds on this one. Let us know what you think. Okay, looks like most of you have voted. Looks like, let me show everybody what we got here. So 93% said financial, 50% said verbal, and then we have about 29% said something else.
Okay. Well, they're all correct. Financial is, of course, the biggest red flag that we have there. And verbal, it does meet the criteria because the arguing and gestures are being directed at Richard, but he's also feeling this distress from having these events happening in front of him. This is his home. He should be able to feel comfortable in his own home. Now, we don't go out and solve every little petty argument that goes on, but the bottom line is they're threatening him a lot by the sounds of it and making his life so very, very miserable. And what are they doing in the process? Emptying his bank account. Another thing could be also that this could be causing him to feel involuntarily secluded. Maybe he's not even leaving the home simply because of all of these activities that are going on. These are things that APS are going to want to look into, and we can sort all that out.
So it is all potential. Again, you guys as frontline workers don't have to know that it is or isn't abuse. You just need to know that something is potentially happening. So if you received this call and you were on the phone line, or you were the options counselor, or you were the case manager, and this was the information you had, what would you do? So here's your options. You're going to call Richard's older brother, Ralph, call the ADRC, call the police, call the Oregon Safe Line, or potentially all of the above. So go ahead and vote so we know what you think. Good job. I see some folks saying call that ADRC. We'll give you all about another 30 seconds here.
It's fun watching.
Okay, it looks like most people have voted. So what have we got here?
Okay, well, Ralph, he might be a good option, but he may want a new house as well. So actually, the ADRC, police, and the Oregon Safe Line are all legal options that will lead you to Adult Protective Services. And as mandatory abuse reporters, that will also fulfill your requirement as a mandatory reporter.
Great.
Okay.
So Ralph, his older brother, would be an option too, but The three in the middle, the ADRC, the police, and the safe line?
I think Ralph would be the last person you want to call. We'll let Rose do that because we don't want to invite more fire or more fuel into the fire. Yes.
Okay, looks like we have a question.
Okay, a question.
Okay, we have a lot of people dying from substance abuse. They're often diagnosed with failure to thrive. How often should their welfare be reported in the course of their addiction? They have the right to refuse treatment and intervention, but they are still at risk, and it still could be self-neglect. So how often should they?
So I can't give you a how often. I can't give you a specific canned answer to that. But if you're working with somebody that you know has these addiction problems and you're seeing a serious decline in their health happening, you're welcome to give a call. There's obviously different conditions that occur as people abuse their bodies over time, and they can become more in serious health. And it really is a good idea, if you're really concerned about it, to give the call to APS, and they can send somebody out there, and you can end up being part of the monitoring system if it is something that ends up having to be monitored. They may go out there and find that, ooh, there really is something really bad, and they might be able to help them find some supports. Because just because somebody has an addiction problem doesn't mean that there aren't supports out there that could possibly help them. I hope that answers the question well.
Well, they'll let us know if it didn't.
Okay.
But bottom line is, we can't give you a how often. It's, it's pretty much your own judgment. You're the one working with the person. You know how much they're deteriorating.
So again, if you get that gut feeling, it's like, wow, this isn't right. Because even like our example previously, Stanley, he could have had some problems that were going on. Maybe Stanley was a drinker or had drug problems, and maybe that was the reason that they weren't paying attention to him. But the bottom line is, if you are seeing something, a sudden change in that person, because you've known them for a long time, make the report and get somebody to pay attention.
We don't get in trouble if we make a report,
not
right?
at all.
There's no, you don't get in any kind of trouble.
Right.
So it's better to err on the side of making the report than not.
Exactly. So back to this other scenario that we were on, this slide is in relation to that, and it speaks about the relationship of abuser statistics. And as you look at that, you can see a breakdown of who the abusers were, and this is for 2015 statistics that our office put out there. And I'll go ahead and tell you what the actual numbers are. So the breakdown of 2,860 perpetrators that were substantiated for abuse in 2015 were 297 spouses, 18 guardians, 191 grandchildren, 306 caregivers, 380 other people, 15 parents, 76 siblings, 518 acquaintances, and 1,059 children. So included in those numbers also are 53 daughters-in-law and 43 sons-in-law. So what we're picking up from this really is that much of the abuse is coming from people that they know. And these statistics, even though they're from 2015, that number is in regards to family. It's a pretty accurate representation of how it plays out. It's usually about half or more, and in this instance, more coming from family. So we're going to want to be watchful in a couple of situations. Personal stress of the person who's protected or the people who provide support. It can serve as an alert to risk of abuse. Either party may be experiencing a divorce or a relationship issue, problems with children or work. There could be caregiver stress. Many are really, really good caregivers that take on a responsibility, and it turns out to be more than they can handle. But an investigation, if it gets called in, we may be able to reveal they need more training, and they just don't know where to get it. a good indicator that care stress is going on is that they're not able to get enough sleep or take care of themselves. Another thing that we want to think about is people living with protected people. They're not only to have constant, they have a constant opportunity to take advantage of situations, and they may be under high stress because that person's declining health or whatever it may be, and they don't often get a break. APS, again, are trained to sort these things out. And then also keep in mind, we mentioned about children and so on. They may be depending on this person for their care needs as well. So what we want to emphasize here is to watch, listen, and communicate, collaborate, and take action. So we want to use all of our senses to pay attention to people. We want to get to know people in our daily lives, and we want to get to know them through interaction. You may not recognize it, but if you see somebody a couple of times, hear somebody a couple of times on the phone, you are going to pick up on these different things. So just pay attention if there's a change. Take a moment to process things that are different, and if you see them in the change, maybe there's something to pay attention to as far as abuse or neglect, or again, self-neglect. And we want to take action by connecting people. How do we do that? We make the phone call, as we've said over and over again.
And we apologize for not having the ADRC number on here too.
Okay, I apologize for that personally. So what do you say when you call? We want you to give the name. There's actually, those who are mandatory reporters, there are legal obligations to gather up as much of this information as possible. But what do you say? The name of the victim, where the event happened, a name of a possible abuser, and your contact information. Another thing to keep in mind there is if there are dangers in that situation, so you can help that Adult Protective Services worker or someone else from a different agency know, or maybe one of your coworkers that works directly with you. Another thing to keep in mind is that you can remain anonymous. Now, in most situations, you're not going to be able to remain anonymous as a mandatory reporter in your duty situation, but if you're off duty and you're required to make the call, you can remain anonymous. The biggest thing you have to remember is don't tell us who you are, because if you tell us who you are, we have to record it. We're legally obligated to do that. That doesn't change the fact that it's still going to be kept confidential. But if you want to be completely out of the picture, then remember, don't say who you are.
But only when you're off duty. When you're on duty, you need to say.
Well, there may be contractual issues. Now, there are people who do make anonymous calls when they're on duty. And if I know that it's somebody who's on duty and is a mandatory reporter, I will tell them, you are allowed to make an anonymous call. However, if we do an investigation and we don't have the benefit of knowing that you are the one who made the call, you may be looked at as a fail to report. So that helps remove the doubt. I know there are situations, though, where people still want to remain anonymous. Maybe they're a family member of the person who's doing the abuse. There's a number of different situations that can come into play there, or their boss is the abuser. I mean, we would want to remain anonymous then. Usually these things will surface eventually, but if you don't want to be the one to make the call or the one who is identified as the caller, that's okay. You can also ask to be kept in the loop. Make sure you ask this in advance because we're not required to tell everyone. But if a complaining witness makes the call and asks us, we'll make a note of that and we'll make sure we get back to you and let you know if it was substantiated or not. Okay, the next slide is just going to show you the 33,000 rings of the phone that we received last year, or different places that received calls. As you can see, the top one there is 1,600 referrals to resources, and we were actually referring to people to the ADRC, Ombudsman, Education and Training, and other community resources. There's a lot of calls that come in. And if you don't have further questions, that is the end of our presentation.
Well, thank you so much, Thomas, for everything you've shared. It strikes so close to home because with a program like Oregon Project Independence, which many of our folks are involved in and work with, they're involved at the request of APS to go and see this consumer.
Right.
Maybe they are working with trying to get them on APD, but the consumer doesn't want to have a claim against their estate or something, and OPI still doesn't have a claim. So they get involved, and it's then figuring out, they're just offering a modicum of services. They're not meeting the whole need. So there's still vulnerability and issues. And so it's nice to know it's okay to have an ongoing conversation, perhaps, with investigators looking at this person's life and trying to assist them with making good decisions and helping them through that maze. So
absolutely. And you know, we've got holes in the safety nets. They're there inherently. It may be because of laws or what have you, but if we work as a community together, we can help fill those holes that might be there, and we can ensure their safety and maybe make their life happier.
yeah, wouldn't that be a great outcome?
I'd like that.
And there is one more slide, I think, with Thomas's information. The very last slide, I believe, has his email address and his phone number. There's a couple of you asking to be able to talk to him outside the presentation with specific questions, and I think he's happy to do that.
I will do that. I can't move that forward so they can see that though, because it's locked.
Is it unlocked now?
There we go. All right, there is my information, and you're welcome to contact us. It will probably be referred to, well, I will do my best to make a referral, but also we have our training number. Excuse me, we have our training email. I actually have to look that up. I should have it memorized because I use it daily.
So he's happy to take these calls and then help forward them to wherever they need to go. So you see his email up there. And you can also send questions to me, and Sandy and I and Thomas can work together to figure out who needs to be the person to take those questions.
Okay, I'm gonna give you two numbers actually,
okay,
as far as contacting, or two email addresses that are separate from mine, because I'm not always here. Sometimes I get hurt like I did when I needed surgery. So OAAPI training is OAAPI.training, TRAINING, at dhsoha.state.or.us. And the next one is a little bit longer. It is OAAPI APS Technical Assistance, and they can answer a lot of the technical questions. They're the ones that actually speak to the investigators. But I would prefer that you lean towards making the call actually to the safe line. Really, ultimately, the safe line is going to get you directed better than we can. But this is the technical assistance location, and they can help you with legal questions. So OAAPI.APST, APS Technical Assistance. So it's APSTECHASSISTANCE at dhsoha.state.or.us.
So I really want to thank you again, Thomas. We really appreciate you being on the webinar today. I want to remind you guys that we did record it, and we will get it closed captioned and get it up probably by the middle of next week on the webinar, on the website with the rest of the webinars. And we will be sending you an email. Watch for an email within about an hour of when we close the webinar. And please take that 5 minutes to do the Survey Monkey, so we'll know how we did and how we can make it better next time, and we'll give some feedback to Thomas about how useful this information was. I'm not seeing any more questions, and we're through the PowerPoint, so hopefully you guys are good, and I appreciate you being here. Next month, it's the second Wednesday of the month in the afternoon. We're not sure what our topic is going to be yet, so if there's anything in particular you guys would love to hear about, shoot me an email or Sandy an email and let us know. We're still in the process of developing what that one will be, but we do have August, we'll be talking with somebody from ACL about working with the tribes in our areas, and then in September, we're going to be talking with our legal aid developer person about abuse and legal aid and guardianship and those kinds of things. So we're excited to have these. We look forward to meeting with you each month, and thanks again so much, and we'll talk to you next month.
And this is Sandy for just a quick commercial break. Next Wednesday, we have our Oregon Project Independence Power Hour. You know, there still is nothing official at all regarding our OPI budget for this upcoming year. We haven't heard anything from the legislature to know what programs are or are not funded and at what level. So I don't think I'll have a magic wand to share, but if I do, you'll be the first to know. But we do have plenty of other topics for us to go over and review. I'll be sending you out an agenda for those of you who are OPI case managers. You'll see that come out on Monday, and I'm looking forward to spending some time with you. So thank you again for your time this afternoon, and I wish you all the best.
Bye, everybody.
Thank you.